Actually, I think that it is a meeting which is dealing with cellular therapy, with CAR T cells, but not only with CAR T cells. I really appreciated the lecture comparing autologous transplant and CAR T cells as the second-line therapy in lymphoma. It was a good answer for us. I really appreciated such lectures about VEXAS, which is something what is rather new, and we have heard about this new problem because I think that we are dealing with these patients, though we didn't know it, and we have some recommendation now how to care or how to indicate these patients for the transplantation. We have heard something about novel drugs or promising novel drugs emerging to bridge myeloproliferative diseases. There was a nice study from German colleagues about using lenalidomide with azacitidine for dealing with relapse of AML and MDS after transplantation. And I really enjoyed the lecture about the engineered T cells against GvHD.